Good afternoon, and welcome to today's webinar on weight loss surgery journey, hosted by Dr. Ariel Rodriguez. Dr. Ariel Rodriguez from Palm Beach Surgical and Bariatric Weight Loss Surgery has over 15 years of experience in general surgery and bariatric surgery, and he's board certified in general surgery by the American Board of Surgery and a fellow of the American College of Surgeons. He performs general surgery, bariatric surgery, and utilizes some of the latest technology, including robotic surgery and minimally invasive laparoscopic surgery. Dr. Rodriguez speaks both English and Spanish, and he is located in Palm Beach County in South Florida, and he treats patients from all over the world. So without further ado, Dr. Rodriguez.
Hi there. Good afternoon. Thank you for being here. Yeah, my name is Dr. Rodriguez, Ariel Rodriguez. I'm a bariatric surgeon. I've been in the area now over 5 years and have over 15 years in training. And we dedicate to the treatment of obesity. We do basically all the weight loss surgical procedures, and we're going to go into a little bit of details here in a minute. But very happy to to try to educate, give some information, and tell you a little bit of what we do in our program. So obesity has become a pandemic, and diabetes goes hand in hand with obesity. We have seen, especially with the COVID-19 issues, that obese patients have not fared that well. It's because it's a chronic inflammatory process and just puts you at risk at many other serious chronic diseases, and it decreases the immune response. And for that reason, it has been compounding the COVID-19 pandemic. And the problem is that these numbers are not getting any better. We have seen that obese and overweight patients go up pretty much every year. It has been relatively stable here recently. However, the numbers show that over 30% of the US population is at least overweight, if not obese. And what are the causes? Unfortunately, obesity is a multifactorial problem, and that's why it's so difficult to lose weight. The patients that come to us is because they have tried very hard multiple schemes, either diets, exercise, and even medications. And by the time they come to us is because they have not achieved a healthy weight. And the problem is that there are multiple factors contributing to this, and treating them all is very, very difficult. But certainly controlling how we eat and overeating is one of the main issues that we try to control with surgery. However, environmental factors and medications play an essential role that we're still understanding. Some of the medications that are commonly used, like hypertension medications or antidepressants, are known to cause or make it even harder to lose weight. Certainly, there are patients that have a strong family history of obesity, and also our sedentary life, especially now with what happened recently. Patients or people in general are not going out as much, they're not exercising, and there were a lot of people that gained a lot of weight during the pandemic. Genetics certainly play a role, and that goes along with family history. And certainly pregnancy makes it, push the body through a period where there is rapid weight gain, and then losing that weight becomes very difficult after. And like I said earlier, these numbers are just staggering. 30% of the U.S. population, 55% have a diabetes, obesity and diabetes combined. 85% of the diabetic patients are overweight, and 50% do not achieve good glucose control. And that's because of how, again, all these two diseases go together. And we see that diabetes, unfortunately, affects the whole body, just like obesity does. The kidneys, the sensations in the food, and the wound healing, and achieving a good glucose control is very, very difficult. And one of the concerning things is, or we've seen patients that are younger and younger that are becoming or come to us with early onset diabetes, and it's because of how their weight has been for the past few years. And then again, we're seeing that these patients are becoming younger and more difficult to control. And again, we think that obesity in general has become one of the greatest global health threats. And I think that the COVID-19 pandemic kind of put that into another highlight where, we see how there was this concept of patients that were obese, but they were healthy in general because they go to their yearly checkup and their doctors basically say, well, you're still healthy, your numbers look okay. However, the chronic inflammatory state of obesity was put to to the test with this COVID-19 pandemic. And again, these were the patients that unfortunately did not fare well. They had a higher chance of having hospitalizations, and when hospitalized, they were the ones that were sicker, going to the ICU and ventilated. And again, the costs are enormous, and despite again newer medications and newer ways to deliver insulin or make the pancreas work, we're still having a lot of issues achieving good control of these issues. And this is again another graphic that shows how the numbers are accumulating. Here in Florida, 25 to 30% of the population is at least overweight or obesity, and then when we go to the Midwest, it's even worse. And again, to me, one of the bigger problems is how our children are being affected by this. Children and adolescents ages 2 and 19 are having a prevalence of obesity of 18%, which is considerably high. And that's around 13.7 million children and adolescents in the United States alone, which are at high risk of developing diabetes later in life. And the problem is that we have seen that once these children have developed a weight issue, most of those kind of linger into adulthood and later on throughout life. All right. And to us, one of the numbers that we look at to kind of determine the treatment options and kind of tailor how are we gonna approach some of these patients is the BMI or body mass index, where we calculate depending on your height and your weight, we come up with a number where you see if it's between 18 and 20 and less than 25 is what we consider to be the range of normal, and anything above that just goes to the overweight. And once it reaches over 40 is what's considered severe obesity. And just to put it in another number, someone that says that is 5'6", at 210 to 215 pounds is already considered class 3 obesity, and anything over 250 pounds is considered severe or extreme obese. And those are the patients that come to us seeking surgical consultation. And this is another graph kind of illustrating the correlation between how the higher BMI, the higher the chances of developing diabetes with time. And that applies to both men and women. So what can we do? The first thing is, attending seminars like this and educating yourself. I think there's a lot of information available to anyone, and there are good and bad information. However, in general, you familiarize yourself with the process of obesity and listening to your body, understanding how your body responds to different type of diets and changes in the environment. We see it all the time where patients move from one area to another, and sometimes these changes, go along with the stress of moving. However, the diet itself and the response to the environment make losing weight more difficult for some patients. And we all can eat a little bit better. Even I, and that been doing this for years. Sometimes I find myself that I can change a few things here and there, eating more fruits and vegetables, leaner proteins and whole foods and whole grains. Keeping up with hydration, controlling your calories. Those are the things that most people understand. However, what they don't sometimes get lost is in the details. Sometimes we think we're eating healthy, but when you look at the labels and you start familiarizing with the amounts of proteins or the amount of hidden sugars and amount of processed food and carbohydrates, you can see that we can all make a little bit better uh, uh, health choices. And part of the problem is the convenience, right? The more convenient some of these foods are now, especially with our lifestyles that we're on the go all the time, we don't have time to meal prep, and you just want to, have a quick break and get a snack. And sometimes those are not the healthy options that are available in that fashion. Again, we all can do a little bit more as far as physical activity. Getting enough sleep is very important. A lot of people are sleep deprived. They don't sleep enough. They don't have quality sleep. Sometimes they have undiagnosed sleep apnea where they stop breathing during the middle of the night, or they don't get enough oxygen and they wake up very restless and basically somnolent throughout the day. And again, there are some of the things that we do is coping with stress. Sometimes our reaction to certain changes in life can and will affect our health in general, specifically our weight as well. So once you have tried all that and still you haven't achieved a healthy weight, that's when we start considering metabolic surgery or weight loss surgery. And these are the two main procedures, which are the gastric bypass and the sleeve gastrectomy. We're gonna go a little bit in detail here. The gastric bypass, what we do is basically make a small pouch out of the first portion of the stomach, and it's completely separate. And then we connect that pouch directly to the intestines, and doing so bypassing the stomach and the first part of the intestines, where is the duodenum and where a lot of uh, pancreatic secretions and hormones are made. And we think that by doing this, not only you cannot eat as much, but also not everything that you eat will get absorbed. And there are a lot of metabolic changes and hormonal changes that happen after this type of surgery, where the resolution or improvement in diabetes are almost immediate. And then as the weight goes down, we are able to take these patients off of some of the medications and are able to improve the energy, quality of life, and overall health. And the most common procedure that we perform is a sleeve gastrectomy, where we basically divide the stomach in two, leaving a small tube, which is about 25 to 20, 25 to 30% of the stomach. And this is a very effective operation. Basically, what we do is restrict the amount of calories that you can eat in one sitting. And also, we think that by removing that part of the stomach, there's some changes in the hunger cycle, because there's a hormone called ghrelin produced in the fundus of the stomach that makes you hungry. And we think that removing that part of the stomach changes that, as well as by having a smaller stomach, food goes through this through it a little bit faster, and that also promotes some hormonal changes and metabolic changes that all contribute a little bit to the resolution of some of these comorbidities that the patients have. So our goals is to, again, get you to a healthy weight, where some of these comorbidities or obesity related diseases that come with it are improved, including diabetes, which is one of our main goals, as well as improve the quality of life, increase longevity, reduce the healthcare costs that are associated with obesity and some of these comorbidities, which include a lot of medications. And here are a list of the most common issues that are related to obesity that improve significantly after weight loss surgery and after the weight loss process has occurred. And for us, again, diabetes is very important. The reflux disease, which is very prominent and imminent in some of these patients, as well as alcoholic fatty liver disease, which has become one of the um, major reasons for liver transplant in the United States, surpassing alcoholic liver cirrhosis. And then there are some others, again, that are included in this, and that's why it's so important that it's not only surgeries. Again, evaluating the patient, understanding what their goals are, and how we can make it better. So our program is nationally accredited for bariatric surgery. It's what used to be called a Center of Excellence. We are board certified and fellowship trained surgeons. We have nutritionists, psychologists, general practitioners, sleep. The sleep lab for the sleep studies, as well as a slew of other members that contribute to the whole weight loss journey, including patients that our staff that will take care of your insurance, take care of um, the details that are needed to get approved in some of the cases, as well as some of the steps that need to happen before you're ready for surgery. And our hospital is state of the art as far as technology. We have dedicated bariatric rooms, dedicated nurses, and in general team to take care of the process and making sure that your stay is safe and again comfortable for the patients. These are our credentials. Again, we are members of the ASMBS, which is the American Society of Metabolic and Bariatric Surgery. And again, some of these are very recognizable, and it's part of what we offer to our patients. Um, these are some of our pictures. One of the things that some of our patients uh, forget is enjoy the journey. Sometimes a year goes by really fast, and all of a sudden you're 80, 100 pounds lighter, and you haven't documented your journey. So we do encourage patients to take a lot of pictures through the process. We'd like to take at least one pre-op picture, and as you go along, we do enjoy the journey with you. And I think that that's very important to remember where you started and what your goals are, and how we're gonna get you there. So with that, I just wanted to let everyone know that we are available for questions. We're available for our consultation. We know that everyone is a little bit different. That's why it's so important to sit down and have a proper conversation and examination. Take a look at the medical history, surgical history, because all those factors influence the type of surgery, the type of treatment that you may need. So with that, I just want to thank you for having me, and any question I'll be happy to answer.
Everyone can ask questions in the Q&A. I do have some questions here already for you, Dr. Rodriguez. The first question is how old, and I guess this would be the gap, how old do you have to be or should you be to qualify for bariatric surgery?
Well, I mean, for us, sometimes it gets tricky because part of my presentation was showing how some of these patients are becoming younger and younger. And for us, we are required to do 18 and above, meaning that, 18 and younger needs to go to a specialized pediatric program, which is probably the only thing that we don't do yet. Most of them are able to wait for us, and then after that, age is just a number. It's about the details of the medical history, the overall condition, to tolerate surgery, etc. So, 18 and above, and the above basically depending on the patient itself.
Wonderful. The next question is, and this is a very common question that we get on most of your webinars, is this covered by insurance? How can we find out?
So yeah, they're very important because finances are a very integral part of the process, and want to make sure that we offer our patients the best possible option. And yeah, insurances do cover it, especially like Medicare and some of the related products. Then after that, it's all about the fine print. There are a lot of um, policies that have a bariatric exclusion, so that is important that you find out beforehand. And you can always call our offices, and there are people that this is what they do, just checking insurance, checking coverage. However, we do encourage our patients to call themselves, speak with their broker or speak with their customer service number, ask them directly if they have bariatric coverage specifically for surgery, and if they do, what are the requirements, because sometimes that's where the process gets caught up, where they have like specific things that they want to see, and sometimes the patients based on that don't meet criteria or have some things that are missing that kind of stagnate the process. So very important that patients again become very familiarized with the process themselves and call and make sure that they understand what type of coverage do they have.
Great. So good to know that not only do you have the team at your practice that does the verification, but also encourage the individual. And like you said, a lot of insurance plans do change from provider to provider, so best to give them a call. Next question I have here is how fast can I go? Well, so how fast can you go back to work after surgery?
So that's yeah, one of those questions that everybody's a little bit different. I will say that for most patients, they feel like about 80%, 90% within the first week to 10 days. And then it takes about 2 weeks to kind of feel almost 100%. But most people are able to go back to work in a limited fashion at the beginning. And then I will say that after 2 weeks, you're almost at full capacity. The only restriction that we give our patients is no heavy lifting for about 2 to 4 weeks, just because, it may hurt a little bit, some of the incisions. But other than that, they return to activity basically the same day of surgery.
Got it. Do you also help the patient with diet and exercise after surgery?
Yeah, absolutely. We, again, and when there's two misconceptions. One is when we talk about exercise, people always automatically think about joining a gym or something like that. And that's not what we want after surgery. We just want you to be, consistently active in terms of at least 30 minutes of light activity every day. That's the minimum that we require, and also that goes a long way. And the nutritional aspect is very detailed. We go like basically day by day after surgery. What can you eat? What can you not eat? What are the things that you need to stay away from, and what are the things that you need to have ready at home after surgery? So it's very detailed. We give them a manual with basically more information they can digest and or have, and then with the visit with the nutritionists, they go into even more details. They have the opportunity to ask questions and personalize, what's going to work for them. So yeah, that's one of the strongest point of our program, and bariatric programs that are accredited in general.
And then our final question, Dr. Rodriguez, and I'm just going to rephrase this slightly as it was written, but uh, is there a surgery, right, from all the multiple options that is better one than another? Or is this relevant more to the patient and how it's referred or recommended by you?
So that's a very important question, because making the decision of what surgery to obtain is a two-way conversation, meaning that sometimes patients come strongly against one procedure or the other. And then when we look in the details, we explain why I believe, or why, based on the data, that procedure may not be the best option. On the other hand, yeah, we try to accommodate most patients where they say that they come asking specifically for a sleeve, and I believe that is a reasonable option, and we can get them close to their goal with that particular procedure. Then we proceed that way. But it's never one procedure fits all. It's a conversation. It's a process. There's some details that we need to look and understand before we can make a final decision. And that's why, part of being an accredited program is being able to offer a slew of options to our patients, instead of, whoever comes to the door just gets the one procedure or two.
Wonderful, wonderful. Dr. Rodriguez, so that wraps up all the questions that we received today. Is there anything additional that you'd like to share? If someone has a question or if they'd like to schedule a consultation, as we can see on the screen, you can reach Dr. Rodriguez through his website at pbsurgical.com, or you can contact his office directly. There is a number there at 257-2800. And once again, in Palm Beach County, located in Boynton Beach, you can speak to Dr. Rodriguez and his staff. They are bilingual. And if you have any questions, they'd be more than happy to reach out to you. Okay.
Yeah, absolutely. We're here to help, and again, reach us. You can reach us in social media as well. I respond to that fairly quickly, as well as for more specific details. Always, it's better to kind of sit down and have a detailed conversation in the office. But we're here to help, and happy to do so.
Wonderful. Well, thank you, Dr. Rodriguez, and thank you everyone who attended today.
All right, thank you guys. Have a good day.
You too.